You will now hopefully have completed successful cataract surgery. This video will help guide you on what to do and what not to do in the days and weeks following your surgery. For the first day and night after your operation, you will have a patch on your eye. The morning after the operation, this patch can be removed and you won't need to use the patch anymore. If you are seeing your doctor the next day, the doctor or the doctor's assistant will help remove the patch. Otherwise, you could remove it yourself the morning after the operation. Within the patch, there will be a plastic shield. If you're worried that you'll rub your eye at night time, you may wish to wear this shield over your eye whilst you're sleeping for the first week after the operation. The pointy end of the shield goes towards the nose, and you can tape this down to your face with some tape that you get from the chemist. When you're outside, you may find that the lights are very glary, and so it may be easier just to wear sunglasses. You may also notice that your eyelid is a little bit droopy in the first day after the operation, but this will normally recover in the first 24 to 48 hours. You will be given some eye drops to use, which should start from the day after the operation when the patch comes off. In general, this is given 4 times a day, although please check with your doctor as to what they would like prescribed. The order of the drops doesn't matter, but you should wait a few minutes between each drop so you don't dilute the previous drop that has been instilled. To put the eye drop in, pull down your lower eyelid and insert the drop. Try not to touch the tip of the bottle to the eye. If you think you've missed, then please try to put a second drop in, as it's better to have more than less drops. The drops are usually continued until they run out at 28 days or 1 month or earlier. If possible, it's preferable to keep your drops nice and cool in the refrigerator or an esky if you're outside. And in most cases, you won't require a second prescription unless your surgeon advises this. After your surgery, it is important to take it easy. You are allowed to read and watch television. However, it's important not to do any strenuous exercise. Please don't rub the eye. Don't do any heavy lifting, such as over 10 kilograms. And try to keep the eye dry, particularly for the first couple of weeks. You are allowed to have a shower, but it's best to either close the eye, or some people like to wear swimming goggles to keep the eye completely dry. If you do need to clean the eye, use clean boiled water and gently clean around the eye with a clean cloth. Please do not go swimming for at least the first month after the operation, as swimming water is often very dirty. Most patients will require 1 to 2 weeks off work following cataract surgery, and during this time you should not drive until advised by your doctor. It's not uncommon to have a little bit of grittiness or discomfort in the eye following surgery. So if you get this, feel free to take some Panadol or some Nurofen or over-the-counter medications. However, you should not require strong painkillers requiring prescriptions, and you should never put in anesthetic or numbing eye drops into the eye for pain. If you are getting pain that is that severe, it's very important that you contact your doctor as soon as possible. Most medications do not need to be stopped prior to cataract surgery. However, if you did stop any medications, feel free to restart these the night of your surgery after discussion with your doctor. In many cases, you may need a change in your spectacle power or refraction following cataract surgery. To do this, we would normally wait at least a month after the surgery, and your surgeon will advise you the best time to go and see your optometrist for an updated spectacle refraction. In the meantime, you may choose to pull out the lens in your spectacle glasses, as this will usually lead to better vision than with the old spectacle prescription in your glasses. Finally, if you do have any questions or concerns, please always contact your surgeon, either directly if they have provided their mobile, or by contacting the clinic that you were booked through.